action. Hello.
Hello, Lisa. How are you doing today?
I'm good. How are you?
I'm good. Thank you for asking. So I'm Sam. I'm going to be your student nurse today. If it's all right with you, I'm going to do a overview postpartum assessment, okay?
All right.
Is that all right?
Oh, yeah, that's fine.
Okay, awesome. So can I see your wristband, please?
Yep.
Will you state your name and date of birth?
Lisa Martin, May 19th, 1994.
Okay, all right. Thank you. So how are you today?
I'm very good.
Okay.
I'm just a little bit tired, but
Alright.
I'm good.
Okay. So before we get started with the whole assessment, I'm just going to take your vital signs, and I am going to take a listen to your heart and lungs and your bowel sounds. Is that okay?
Yep.
Okay. Also, before I start with that, do you have any pain right now?
No, not at all.
Okay, great. If you do end up having some pain or discomfort, don't hesitate to let me know, okay?
All right, thank you.
All right, you're welcome. So, I'm going to take Lisa's pulse, and while I take her pulse, I'm going to take her respirations. After I am finished with that, I'm going to take her blood pressure, and then I'm also going to take her temperature. Okay, Lisa, I'm going to go ahead and take a listen, all right? I'm going to pull your gown up just a little bit. You could just take nice, normal breaths, okay?
All right.
And then bowel sounds, I will listen in all 4 quadrants. Okay, everything sounds really good, Lisa. So, have you noticed any pain in your breasts at all?
No.
Okay. Have you noticed any lumps, any abnormal discharge other than your milk?
No, not at all.
Okay, any redness?
No.
Any heat?
No.
Okay. Sorry, that's a lot of questions. Is it okay with you if I just palpate, which means just touch around, feel around your breasts, just to check for any abnormalities?
Yeah, that's fine.
That's okay? All right, so I'm going to put on gloves right now. All right, I'll try to keep you covered up, but I do want to get a good visualization, okay?
All right.
All right. So what I'm going to do is palpate each breast in a circular motion. I'm going to feel for lumps, any bumps. I'm going to feel for any excess heat. I'm going to look for any redness, and I'm also going to make sure that the nipples are intact. Lisa, have you noticed any more pain with your nipples?
No.
Okay, and obviously I will ask, but I can also visualize that there is no cracks or abnormal redness or blisters on her nipples. And that could be a sign of poor latch with breastfeeding, so we just would want to make sure that we assess that. Okay, the next thing I'm going to do, Lisa, is palpate your uterus. So I'm going to feel around on your belly and make sure that everything feels okay. Is that all right with you?
Yeah.
Okay. So what I'm going to do here is use the 2-hand technique to feel her uterus. So I'm going to put one hand at her umbilicus and then the other hand right above the symphysis pubis. And I'm going to palpate the uterus, and I'm going to feel if it is firm or boggy or soft. It should be firm. Lisa, if you notice that your uterus is cramping or if you're having excess bleeding, then what you can do is give yourself a fundal massage for about 1 minute, and this will help with the bleeding. So her uterus is firm. I'm also going to feel if her uterus is deviated or if it's midline. It should be midline. If it's deviated, that could just be a sign of a full bladder. So, Lisa, it's good to empty your bladder about every 2 hours. It's pretty easy to forget sometimes to go to the bathroom. And the last thing that I'm going to do here is measure the uterus. I'm going to just use finger breadths, and for example, Lisa, your uterus is 2 finger breadths below your umbilicus. Okay, so the next thing that I'm going to do is just ask some questions. I already listened to bowel sounds, so Lisa, have you had a bowel movement Did you have your last bowel movement before delivery or after delivery?
It was before delivery.
Okay. Have you noticed any problems with trying to use the restroom, or have you noticed any constipation symptoms at all?
I just really don't feel like I have to go.
Okay, that's completely normal. Constipation can be pretty normal after birth, so it's really good to increase your fluids and your fiber, and also, get active if you can, walk around a little bit. And if you do notice the constipation getting worse, you can ask your nurse, and we can offer some stool softeners for you. Okay?
Okay.
Okay. So how about your bladder? When was the last time that you voided?
I would think around 4.5 hours ago. I've just been really tired.
Okay. Did you notice any stinging, burning, abnormal odor with your urination?
No.
No? Okay. If you do, just please let us know. That can be a sign of a UTI, especially if she was a C-section patient or had an epidural. She could have had a Foley catheter placed, and that definitely puts the patient at higher risk for a UTI. So just let us know if you notice any of those signs, okay?
Okay.
Lisa? All right, so what I'm going to do next is look at your pad. Is that okay?
Yeah.
Okay, so I'm going to do hand hygiene again and also put on gloves for this assessment. I'm going to pull down your blankets a little bit. I'm going to look at her pad, and I'm going to assess the lochia. I will assess the color. If she's still in the hospital postpartum, most likely it will be rubra, which is red. I will assess for clotting. Lisa, have you noticed any clots?
Just little ones.
Okay, that's perfectly normal. Lisa, if you do notice clots that are golf ball size or bigger, please let us know, because that's considered abnormal, okay?
Okay.
So when was the last time you changed your pad, Lisa?
About an hour ago.
An hour? Okay. So we do measure the amount of blood based off of an hour. So, for example, Lisa, if you saturate your pad within 1 hour, that's considered abnormal and is a sign of excess bleeding. Okay?
Okay.
So, yeah. And is there any odor with your bleeding?
No.
Okay, perfect. And like I said earlier, Lisa, if you do notice that excess bleeding a little more than normal, you can give yourself the funnel massage for 1 minute, and you can also try to empty your bladder, and that can help.
Okay.
Okay? So the next thing that I'm going to do is I'm going to roll you over, if that's okay.
Yeah.
All right. So what I'm checking for here is her episiotomy site. If she did have an episiotomy, or if she just had a natural tear, I want to check her perineal area. I can use a pen light for this because it can be hard to visualize sometimes. So, what I'm checking for is her incision site, the stitches. I'm going to use the acronym REDA, which stands for redness, edema, ecchymosis, drainage, and approximation. This just indicates some signs of infection that we want to watch for. Also, we can look in the anus and look for hemorrhoids. And Lisa, hemorrhoids are very common throughout pregnancy and postpartum. So if you do notice that, just know that they can subside with time. And if you have any issues, you can always call us back and come see us, and we can help with that. Another thing I want to assess while I'm back here is the epidural or spinal site. If she did have one, I'm going to check with the acronym REDA again. I'm going to make sure there's no signs of infection. Ask for pain. Are you having any pain on your back, Lisa?
No.
Okay, great. All right, I'm rolling her back over. The next thing that I'm going to check, Lisa, is for DVTs. You know what a DVT is?
No idea.
Okay, well, let me tell you. So, a DVT is a blood clot that can get lodged in your legs. And this can be common, but it is not a good thing. So what you want to do, first I'll tell you, if you get up and ambulate or walk around as early as you can, that's a great way to prevent DVTs from forming, okay?
Okay.
So, to assess for DVTs, I'm going to look for unilateral swelling, redness. I'm going to ask, Lisa, are you having any calf pain?
No.
Okay, good. So I will also let you know, Lisa, that bilateral swelling on both legs is normal for pregnancy. That's just normal dependent edema. I'm going to feel both legs. I'm going to check both pedal pulses and do capillary refill on both feet. Okay? So, a couple other things that I want to add. So while if my patient was a C-section patient, I'm going to assess, while I'm assessing the uterus, I will also assess the incision site on her abdomen using the acronym RITA again, just as I did with the episiotomy and the epidural site. Another thing that I would like to check is her IV site. If she did have a C-section, she most likely will have an IV. So with that, I just want to check also for signs of infiltration or infection, any redness, any cool patches around the area, any drainage, okay? And I want to make sure the dressing is intact and there's no blood on it or anything like that. And then also, I will check if she has a Foley catheter in. It should be out within 8 hours. And if it's not, I can try to get it out as soon as possible to prevent the occurrence of a UTI, okay? Throughout my assessment, I will be assessing Lisa's emotions and her general affect. Lisa seemed very calm and cooperative. She seemed in a good mood, generally. I can also ask, just, Lisa, how are you feeling today? Are you feeling okay? Are you feeling well rested? How's your appetite? I just want an overview look at how she's doing, okay?
Okay.
So you're doing okay, Lisa?
Yeah, I'm just still a little tired.
Okay, well, I'm going to get out of here and I will let you rest, all right?
All right, thank you so much, Samantha.
You're welcome. Is there anything else I can do for you before I leave?
Could you turn out the lights when you go?
Yes, absolutely. Thank you.